The search for mental health support for a teenager can feel overwhelming for any family, but a powerful new approach is here. Virtual Intensive Outpatient Programs, or IOPs. A surprising fact? Teens are far more likely to finish virtual programs than in-person ones, and the results are life-saving. Most teens with suicidal thoughts no longer reported them after treatment. So how is this possible? We'll break down the evidence for why virtual IOPs achieve these results. First, the bottom line. Do they work? Research shows virtual IOPs achieve outcomes that are comparable, sometimes superior, to traditional care. But what do positive outcomes look like for common struggles like teen depression and anxiety? For depression, studies show a significant symptom drop, with many teens moving below the clinical diagnosis threshold. For anxiety, results are just as strong. One program saw 92% of teens report symptom improvement during treatment. So the clinical data is clear. On measures of direct treatment success, virtual IOP delivers. But strong outcomes and completion rates don't happen by chance. Unique mechanisms in the virtual model drive this success. One of the most powerful is in-environment healing. Therapy happens in an office, but the struggles happen at home, at school, in real life. With virtual IOP, a team can learn a coping skill for homework stress and apply it minutes after the session ends, right at their desk. This closes the gap between theory and practice, making therapy more immediate and relevant to their daily challenges. Beyond where it happens, the treatment is highly personalized. Virtual care allows for specifically adapted plans. But if a teen is at home, are they isolated? How does virtual therapy build the vital peer support that they need? The reason teens and families stick with virtual IOP is simple. It removes barriers. Let's look at the practical hurdles it overcomes. First, it reduces stigma. There is no walking into a clinic. Treatment is private, taking place in the comfort of their own room. Second, it helps the whole family. Parents can join sessions without leaving work early, boosting family involvement. Third, it erases geography and scheduling conflicts. Rural teens get top specialists, and after-school sessions mean no missed classes. When you remove these logistical and social roadblocks, consistent attendance becomes possible, directly causing those high completion rates. So it delivers results and is accessible. But what about the connection? Can a therapist truly build rapport through a screen? The answer is yes. Skilled therapists use the platform to their advantage, using chat for shy teens and interactive digital tools. For a generation of digital natives, this environment is natural. Integrating tools like mood trackers makes the process more relatable. And that question about peer support? Virtual IOPs create unique communities. Teens find similar peers they might not find locally. This is not an all-or-nothing option. Virtual IOP is a key part of the mental health ecosystem, ideal as a step down from inpatient care. Now let's connect these threads. How do accessibility and unique therapies create a larger, system-wide impact? Recall the accessibility. Because virtual IOP is easier to start and maintain, it enables earlier intervention before a condition worsens. This proactive care isn't just better for the teen. By preventing crises, virtual IOPs reduce the need for costly emergency room visits. And because teens are learning to manage triggers in their actual home, they are better equipped to handle stress long-term, making relapse less likely. Significantly, this access and success holds true regardless of insurance type, showing similar positive outcomes for all youth. So, the evidence is clear. Virtual IOP is a powerful modality because it's clinically sound, radically accessible, and works for today's teens. The point is getting the right treatment in the right way. By meeting teens where they are, it drives engagement and program completion. Virtual IOP is not a lesser alternative to in-person care. For many teens, it is a more direct, more available, and more engaging path to recovery. If you're a parent, educator, or provider looking for support, consider virtual IOP as a primary option for the teen in your life.